Bass Coast Health is tremendously proud and privileged to serve our community. This is our community, our family, friends and neighbours, and each of us come to work every day to improve our services.
It's been a big year at Bass Coast Health with the opening of the Wonthaggi Hospital expansion. We saw our ED open in December, our acute medical ward Kodalainen open in January, and our theatres open in early April this year.
The operating theatre has moved into our brand new operating suite, which comprises of 4 state-of-the-art theatres, including an endoscopy suite, so that we can provide services to the community so we don't have to travel to Melbourne to have our operations.
New clinical handsets provide cutting-edge technology for improved voice quality and improved connectivity, and the ability to expand to new services and allow mobile communications for staff on the go where and when they need it.
So in the last 12 months, the clinical informatics team have been working on a number of projects as well as supporting our current systems at Bass Coast. Some of the achievements this year have included designing the e-ordering for pathology that's in its testing phases, designing a new observation chart and many other functions in the system.
We have been working really hard at building our team. We've actually seen the employment of 9 brand new midwives to the Bass Coast family.
So we started off with our midwifery campaign, then we moved on to our allied health team. We celebrated that journey together at the end and getting a really good result. So now we're on to our nurses and looking forward to the growth of Bass Coast Health.
We have just made some records for Bass Coast Health. We've had 26 babies in November, which is actually a record for us, and that 26th baby was actually our 200th for the year. But within that month, we've also managed to make sure that the outcomes for our women are meeting all the Victorian standards or actually bettering some of the standards. Everything I hoped that coming to Bass Coast would be is actually coming to fruition. There's a buzz in the air, like we are really, really happy to be at work together. And coming forward, it's going to continue.
Better at Home incorporates hospital in the home as well as gem at home. We are now also doing iron infusions as well as high-risk foot clinic. Keeping people at home is much more conducive for patient health and wellbeing, with speedier recovery times and have better outcomes while they are in their own environments. One of our successful programs under Better at Home is our CCF management for heart failure. We've had successful outcomes and they're not being readmitted back into hospital.
We've also been successful in graduating our very first nurse practitioner candidate into a nurse practitioner fellowship, who's now working at Wonthaggi Hospital in the new department. And also we've had a number of projects that we got up and running and completed. One of them was the partnership with our colleagues at Alfred Cardiology with the telehealth project to provide virtual services for patients presenting with chest pain in the department, which has reduced the rate of transfers to external services by up to 50%.
At the hospital, we have the Aboriginal Health team, which is very exciting. We have myself and we have an Arlo, and we're also advertising at the present moment for an Aboriginal cadet in allied health and in nursing. Bass Coast Health is part of the reconciliation network with our local, it's called the BCRN, and it's linked in with our local nature parks, and we're linked in with the Border Board and Miley Libraries, and also Bass Coast Council. We've organised the Reconciliation Action Plan. We're putting together an advisory committee for our community as well. Please don't hesitate. Come and have a yarn. That's what we want. We want people to come in, have a yarn and feel safe with them when they come in and see us.
Volunteers, they're invaluable. We've got such a range of volunteers here that I was actually astounded with the amount of different types of departments we've got.
I'm actually part of a team. I'm a driver, but there's all sorts of people. There's gardeners, concierge, people who go onto wards and...
wayfinders, concierge, auxiliaries.
And I just love being part of the community, driving around. It's just great.
I just see it as a privilege and a blessing to be able to help other people and to give back to what I was, that gave to me and my husband.
Looking forward, we're rapidly building the Phillip Island Community Hospital right next door, and also we're very keen to engage and partner with our radiology colleagues to try and set up a on-site radiology service. So we're very keen and very excited about what's happening in 2024, and looking back, we're very proud of what we've achieved in 2023.
Today is a celebration of the year that was, 2022 to 23, and we could not have achieved all we did without the extraordinary efforts of each and every one of our 1,100 plus staff, our 200 plus volunteers, and all of our community. Our staff continue to work above and beyond because they deeply care about our community, and we are forever grateful for the opportunity and for your support.